Good evening, everyone, and welcome to our third live virtual drop-in session with Dr. Probhodana Ranaweera. I'm your host, Tharuka Prematilaka. We all know that women are important in shaping our families and our society. They are the heart of society that drives progress, and therefore, their well-being matters not just for themselves, but also for the strength of our community. And that's why we are here today to answer questions asked by women about their own general health and pregnancy and empower them with the right medical knowledge for them to lead a better life for themselves, for the society, and for the new lives that they nurture. And we wouldn't have been able to do this without our amazing obstetrician and gynecologist extraordinaire, Dr. Probhodana Ranaweera. So without further ado, let's welcome our brilliant one and only Dr. Probhodana Ranaweera to the show. Good evening and welcome, Doctor.
Good evening, Taruka.
All right, so let's get started. We do have a number of intriguing questions on a variety of topics listed out today. And a quick note to all our viewers, although our anonymous question submission link is now closed, if you do have any questions regarding the topics that we talked today, please feel free to type it in your comment section and we will do our very best to address them during the session. So moving on to our first question, Doctor. Can having multiple fibroadenomas in the breasts affect breastfeeding, and if yes, how? So before you answer this question, Doctor, please explain what fibroadenomas are and what factors affect their development as well, and then answer the question.
Right. So fibroadenomas are what we call benign type of tumors, that is non-cancerous. So which are commonly seen, in the general population. So they are harmless, but if we see them and there's a tendency for operation, but it depends on the location and the size of the fibroadenomas, right? To the answer the question, we don't know the exact cause for fibroadenoma. It runs in the family sometimes. We call them multifactorial. There can be different reason for them to develop, but we don't know exactly what is the cause. However, unless there's a big fibroadenoma which near the areola or that area where a baby has a problem attaching to the breast, there's no other issue when there's fibroadenoma to breastfeed.
All right, thank you very much, Doctor. And can these multiple fibroadenomas be recurrent?
They usually do. They usually come from time to time, and sometimes despite removing them, it may not the same one, but new ones also appear.
All right, thank you very much, Doctor, for explaining what fibroadenomas are and how it's impacting breastfeeding. Moving on to our next question, which is in Sinhala. මේ කාන්තාවගේ වයස අපි දන්නේ නැහැ වෛද්‍යතුමනි. අය කියලා තිබෙන්නේ ඇයට අවුරුදු ගානකින් මෙන්සස් හැදුනේ නැහැ කියලා. ඇය ගොඩක් සිංගල බෙහෙත් කරලා තියෙනවා. ඒ කාලෙදී හැදිලා තියෙනවා. හැබැයි දැන් සිංගල බෙහෙත් කරන්නේත් නැහැ කියලා තමයි සඳහන් කරන්නේ. ඇය විවාහ වෙලා අවුරුදු 2ක් වෙනවා කියලා සඳහන් කරලා තියෙනවා. ඉතින් ඇය ඉක්මනින්ම දරු පිළිසිඳ සිදුවීමකුත් බලාපොරොත්තුවෙන් සිටිනවා. ඉතින් ඇය අහලා තියෙන්නේ ඇය කරන්න ඕන ප්‍රතිකාර මොනවද කියන එකයි. ඉතින් වෛද්‍යතුමනි මේකට පිළිතුරු දෙනකොට මෙවැනි තත්ත්වයක් තියෙනකොට කාන්තාවක් සුදුසුකම්ලත් වෛද්‍යවරයෙකු මුණ ගැසීම වැදගත් වෙනවා. එසේ වැදගත් වෙන්නේ ඇයි කියන එකත් පැහැදිලි කරලා දෙන්න.
එතකොට දැන් පීරියඩ් නොවීම අපි දැන් මට මේ වෙලාවේ පොදු උත්තරයක් දෙන්න වෙනවා. මොකද දැන් තාරුක කිව්වා වගේ වයස ඉතා වැදගත් වෙනවා. උදාහරණයක් විදිහට අවුරුදු 48ක කෙනෙක් පීරියඩ් වෙන්නේ නැහැ කියපුවමයි අවුරුදු 20 ගණන් වල කෙනෙක් පීරියඩ් වෙන්නේ නැහැ කියවමයි ලොකු දෙකක්. ඒ දෙකේ හේතු විවිධාකාර වෙනවා. ඒ නිසා මම ජෙනරල් ගත්තොත් එහෙම සාමාන්‍යයෙන් වැඩි වියටපත් වුණාට පස්සේ ඒක අවුරුදු එන්න යම් වේගන එනවා. අපි තම අවුරුදු දැන් අපි ලංකාවේදී අවුරුදු 11ක් 16ක් අතර ගොඩක් කාන්තාව නැත්නම් ගැහැණු ළමුන් වැඩි වියටපත් වෙනවා. ඒ වැඩි වියටපත් වූ දවසේ සිට අපි කියන ආර්ථව භාවය එහෙම නැත්නම් මෙනෝපොස් වෙනකන් දැන් අපි ලංකාවේ අවුරුදු 53 තමයි බහුතරයක් කාන්තාවන් මෙනෝපොස් වෙන අවුරුදු කියලා අපි ගන්නෙ. ඉතින් ඒ වෙනකන් පීරියඩ් සාමාන්‍යයෙන් මාසෙ විය යුතුයි. නමුත් ඒක එක එක හේතු මත වෙනස් වෙන්න පුළුවන්. නමුත් පීරියඩ් නොවීම අපි එක දිගට අවුරුද්දක් පීරියඩ් නොවුනොත් අපි ඒක ආර්ථව භවයද කියලා හිතන්න ඕන. විශේෂයෙන් අවුරුදු 45ට ඉස්සෙල්ලා අවුරුදු 45න් පස්සේ ඒක උනත් අපි සාමාන්‍ය ආර්ථව භවයක් විතර ගණන් ගන්නවා. එහෙම නැත්නම් අපි 40 විශේෂයෙන් අවුරුදු 40ට ඉස්සෙල්ලා අපි කියන්නේ බෙහෙත් නැතුව පීරියඩ් වෙන්නේ නැතුව ගියොත් අපි ඒක ගණන් ගන්නේ ප්‍රීමැචුර් මෙනෝපෝස් එක නැත්නම් නියමිත කාලයේ වයසට ඉස්සෙල්ලා ඇතිවෙච්ච ආර්ථව භවයක් කියලා. ඉතින් එහෙම ආර්ථව භවයක් වුණොත් ඒකට හේතු බලන්න ඕනේ. ගොඩාක් හේතු තියෙනවා ඒකට. අපි ගත්තොත් මොකද අපි දන්නවා මේ ආර්ථව නැත්නම් අපේ menstrual cycle එක පවත්වා ගන්නේ මුලේ ඉඳලා එන හෝමෝන කිහිපයකින් සහ ඩිම්බකෝෂ වලින් සහ ගර්භාෂය. ඉතින් මේ ඒ හැම අධීරයේම ප්‍රශ්නයක් වුණොත් මෙන්සස් නොවීම විය හැකියි. ඒ නිසා අපි වැදගත් වෙනවා ඒ වගේ ප්‍රශ්නයක් තියෙනවා නම් එයා ඉක්මනින් වෛද්‍යවරයෙකු ළඟට ගිහිල්ලා ඒ ගැන සොයා බලන්න වෙනවා. ඉතින් අපි කොහොමද බලලා ඉතින් ඒක ගොඩාක් පරීක්ෂණ කරන්න සිද්ධ වෙනවා. විශේෂයෙන් නියමිත කාලයට ප්‍රීමැචුර් මෙනෝපෝස් එකක් වෙලා කියලා අපි හිතනවා නම් අපි බලන්න ඕනේ යාගේ ඩිම්බකෝෂ ප්‍රශ්න තව ගොඩක් දේවල් එයා ඒ වගේ කාන්තාවක් අපි හිතමු සමහර කියන්නේ ලදරු අවධියේදී හරි ලොකු වෙන කාලේ හරි අපි හිතමු කැන්සර්ස් තිබිලා ට්‍රීට් කළා හරි ගොඩාක් දේවල් තියෙනවා මේ අපිට එහෙම ආතර නොවෙන්න. ඉතින් ඒ නිසා මෙන්සස් වෙන්නේ නැත්තම් අපි ඒක බැලුවා. අපි සාමාන්‍යයෙන් අපි කියන්නේ රිප්‍රොඩක්ටිව් ඒජ් ගෲප් එකේදී අඩුම ගානේ මාස 3 සැරයක්වත් පීරියඩ් එකක් විය යුතුයි කියලා. ඒකට දිගටම පීරියඩ් වෙන්නේ නැත්නම් ඒක බලන්න ඕනේ. ඒතර බෙහෙත් වලින් පීරියඩ් වෙනවා කියන්නේ ඒක අසාමාන්‍ය දෙයක්. කියන්නේ අපි ඒක සිංහල වේවා බටහිර වෛද්‍ය වේවා අපි බෙහෙත් දීලා පීරියඩ් ගන්න පුළුවන්. ඒකට නමුත් ඒක අසාමාන්‍ය එකක්. ඒ වගේම එවැනි අවස්ථාවලදී මේ කාන්තාව ලදරෙකුත් කියන්නේ බබෙක් හදන්නත් ලෑස්ති වෙනවා කියලා තියෙනවා. නමුත් මත දැනන පීරියඩ් වෙන්නේ නැත්තම් දිබ්බ පිට වෙන්නේ නැහැ. දිබ්බ පිට වෙන්නේ නැත්තම් බබෙක් හදන chance එක almost 0. නිසා බලන්න ඕන ඇයි එහෙමුනේ දිබ්බ නැති වෙලාද පීරියඩ් නැවතුනේ හෝමෝනෙන් නැතු හින්දාද වෙන අපි හිතමු වෙන සමහර ටියුමර්ස් නම්නම් හින්දාද ඒ වුනේ කියලා බලන්න. නිසා එයාට දෙන්න පුළුවන් උපදෙස් තමයි ඉක්මනින්ම වෛද්‍යවරයෙක් හම් වෙන්න කියන එක.
හොඳයි බොහොම ස්තුතියි වෛද්‍යතුමනි ඒ කරපු දැනුවත් කිරීමට. ඉතින් මෙතෙන්දි වැදගත් වෙන්නේ කාන්තාවන්ට කියන්න ඕනේ කියන්නේ ඇය රීප්‍රොඩක්ටිව් ඒජ් එකේ ඉන්නවා නම් ඒ කියන්නේ එවැනි අවස්ථාවකදී ඔසප් වීමක් මාස 3කටවත් සිදු වුණේ නැත්නම් ඔවුන් වෛද්‍යවරයෙකු මුණ ගැසිය යුතුයි කියන එක තමයි ඔබ කියන්නේ. හොඳයි. අපි එහෙමනම් ඊළඟ ප්‍රශ්නයටත් යමුවම ඒකත් ඔසප් චක්‍රයේ ආක්‍රමිකතා සහ මේ ආර්ථව භවය පිළිබඳව අහලා තියෙන ප්‍රශ්නයක්. ප්‍රශ්න ඉදිරිපත් කළ තියෙන ඉංග්‍රීසි වලින් okay, so she's saying she's 39 years old and her menstruation cycle is happening every month, which is good news, but lasts usually 3 days. And after that, there'll be a watery discharge few days after menstruation has stopped. During this time, there will also be lower abdominal pain, and she's asking if this discharge and pain normal after the cycle has ended. And during the cycle, she says she doesn't have any pain. And the cycle has usually been 5 to 7 days, but now it's 3 days. So she's also wondering whether she's reaching perimenopause as well. So given she seems to have a couple of questions here, doctor, let's just break it down so we can make sure that we answer everything. So first of all, can you please explain how does the duration and intensity of menstrual bleeding typically vary throughout women's reproductive years, and what is considered normal, and whether 3 days is considered normal in this case?
Right, yes, good question. So basically now at the beginning of menstruation, that is soon after the first period up to about 20 years, we are not worried about the regularity of the periods. They can come haphazardly, and the duration can be very can be varied significantly. Sometimes 2 days, sometimes 5 days, sometimes 7 days. Likewise, even the first few years. But once the ovulation starts to happen regularly, then the cycles become regular. In fact, any woman who's having a menstrual cycle regularly, 90% of them will be ovulating. So that's important. And also we talk about the duration. Now once the menstruation starts, with if it is more than 2 days and less than 7 days, we consider them to be normal. And the pain or the pain should not interfere with their normal day-to-day activities. It should be tolerable, and in the sense, if you take even a paracetamol and it goes away, and you are not your work or studies or whatever is not affected, then we consider that pain to be normal. And the bleeding, it should not drop your hemoglobin level, and then it's considered normal. Or also, we also say, even if the HB is not dropping, if again it interfere with quality of life, right? There have been flooding, in the sense there have been embarrassment moments, and you had to wear a lot of pads, and then that we consider it to be abnormal. And the cycles can be from 21 days to 35 days, we consider. So, but the only requirement is, whatever the woman's cycle, it has to be maintained. For instance, if somebody is having a cycle of 24 days, she should have a 24 days with a plus or minus 3 days. So majority of women will have a 28-day cycles with plus or minus 3 days, and some of them will have 35-day cycles. So if the cycles are longer than 35 days, we consider them to be abnormal. If the cycles are less than 21 days, we consider them to be abnormal.
All right, thank you, doctor. So we know now that her cycle is normal and 3 days is also fine. Okay, so moving on to the next concern that she had. How does the presence of lower abdominal pain and watery discharge after periods relate to overall gynecological health, and whether it should be a cause for concern, or is it normal to have abdominal pain and or watery discharge?
Okay, right. So now she has not stated whether she has had babies, and especially sometimes some women who had undergone cesarean section, there are rare complications. We call it, there's a small niche appearing in the site of the surgery where blood collected during the menstruation, and then it get clotted, and after a while, after that when clot, it's become liquefied after time. So when that liquid come, it like watery, and that the body is trying to get rid of that clot, will cause pain. And also sometimes it can be normal if it is odorless, and it doesn't like cause any problems to her day-to-day life or even her sexual activities. We consider them to be, there's something called physiological discharge as well. The other thing that I can think of is that because she also mentioned, I think in the question she has mentioned that she has had a longer duration of days. Now it has become 3 days. So sometimes her periods get blocked with a clot, and then after a while it becomes liquefy, and then starts to come out, and with that she start to I don't know whether she has bleeding afterwards. That can happen. So overall, if she now what I see is that if somebody raised that as a question, that means it's bothering her normal day-to-day activities, or there's a concern. So in that case, it's better to check it out.
All right, thank you, doctor. And lastly, although I'm sure that she's not reaching her perimenopause as you have explained, but can you just quickly tell what's the typical age range? I think you mentioned it, but maybe reiterate it again. And also, like, can you mention the key symptoms for a woman to identify that she perhaps is reaching perimenopause?
Right. So as I told you, after 45 years,
Yeah.
if they stop periods, that's normal. But majority of the women will undergo what we call this perimenopausal period for a couple of years, maybe about 3 to 5 years sometimes. So during that time, they will start initially the menopausal symptoms, where they have hot flushes, and then they have night sweats. They start scolding their husbands or the people around them, so we call irritability. Sometimes forgetfulness, right? And also, more importantly, when it comes to periods wise, they become irregular, and they're going to be farther apart until it stops completely. And now menopause is a retrospective diagnosis. So if somebody has no period for 1 year in the appropriate age group, then we call them to be menopause. So let's say after 9 months, if they suddenly start bleeding again in the 10th month, then still she has not menopause, then it's still perimenopause. The perimenopausal symptom or the menopausal symptoms can appear in perimenopausal period. So that's one of the reasons for treatment as well. So I like to take this opportunity to tell because those days hormone treatment for perimenopausal and menopausal time period for menopausal symptoms uh, kind of got initially because of a study called WHI study, where they found that initially it increased the breast cancer and stroke, and also the conclusions were that it caused more harm than benefit. So it went out of practice. But then when we reanalyzed the data, then they found that there is a window period during the perimenopausal period. If you start hormonal treatment, it's actually uh, beneficial for women. So it has come back now. So women need not to suffer with the with the menopausal symptoms, because they can be really affecting your quality of life for some women. Majority, and having said so, majority of the women have a graceful menopause, right? So with time they get these symptoms, but they are not too bothered about it, and then come to menopause and without any major concerns. But significant number of women will have serious symptoms which interfere with their normal day-to-day activities. So it's mandatory, so there's no need to suffer. But there are contraindications and concerns when we are starting hormone therapy. But with somebody who's experienced and you know uh, uh, willing to prescribe hormone treatment, that woman should go on and meet that person.
All right. Thank you very much, Doctor. And to those who don't know, we have talked about menopause and perimenopause in detail in one of our episodes in What Matters to Her Facebook video series as well. So you can find those episodes in our Facebook page as well. So moving on to our next question, Doctor, we are looking at a very delicate topic that I think affects many women, although we don't talk about it openly. And that's why I love this program, because women can submit their questions confidently, because their privacy and anonymity are guaranteed as well. So the question is, please explain reasons for unbearable pain during sexual intercourse and the inability to achieve orgasm through it, while being able to do so through masturbation easily. And she's asking if this is abnormal for a female. And then she's also mentioning that the pain can even last another day or two. And sometimes stomach pain also hurts badly. And she's asking what could be the reason for that as well, and whether she needs any medicines or surgery, and what should she expect from a doctor if she wants to seek help. And she's lastly saying that it's no fun and stressful, and I end up crying alone afterwards. So currently, intimacy is taking an emotional toll on her, which shouldn't be the case, I believe. So she has a couple of concerns, doctor. So let's break it down once again. So first of all, can you please explain why orgasm through masturbation could be easier than sexual intercourse, and if this is normal for a female, and if the relationship dynamics play a part in this as well?
Yeah, so Taruka, I will tell a bit of introduction for the question also, because probably she's Sri Lankan, right, or the South Asian popular, but still it can happen in the Western countries also. Though, so painful sexual intercourse is a very, very common symptom, especially in the our part of the world, because most of the time the females are brought up in a certain way, and so they are not taught any sexual education, and even in the school it's a hush hush topic, right? And a lot of women are asked not to look at that area, don't look at this, don't do that, and all that kind of thing, restrictions. And for majority of females, having sex is doing A levels without ever going to school. So now this actually my pet subject. I think when we this question comes, I think Taruka, it's time we do a proper episode on this this topic, because now in 2009 I met a couple who had been married for 8 years. They never had sex, and then at that time they were going to divorce, but now they're married with 3 children. But the funny thing is that both of them were doctors, so they know the cause of it, they know where to find help, but they have not sought any help up to that point where it has come to a place. So now this sexual dysfunction can be a majority actually functional, but I tell you, functional is actually something to do with the brain and the relaxation and a lot of things. In a very minority of patients, it actually can be structural. That is, there is something wrong with their vagina, either they have the development problem. So from 2009 up to now, I have helped a lot of women and couples, or rather than women couples, with this problem, and I have seen only two people or two patients who actually had a structural problem. So it's mainly psychological, right? And there are many reasons for that. But for majority, it's actually the fear, or the what the what do you call the lack of knowledge regarding what's happening is the cause. So obviously, now there can be a very tasty food, but then the first day you tried it, it was too hot or something, and then you burn your mouth, and then people can tell you, here, this is the tastiest food in the world, try it. I said, no, I tried it once, I don't want it, right? So to answer your question, so why somebody can do masturbation and then can't do sex? Because masturbation, you are in control, you are the one who's doing it, or so there's no pressure, right? And then the whole thing is under your total control, and you have experienced that before, and it's a pleasurable thing. So the sexual intercourse, because there are two people involved in it usually, and then when you try to have sex, then if it is painful in the first instance, nobody's going to like it again, right? And sadly, even for males in Sri Lanka, the sexual education is zero, and majority of them learn sex by watching porn movies, and they forget that these are actresses and who are paid professionals, and the men think that they know everything, but then when it comes to the real act, then there are one person who thinks he knows everything, and there's a woman who don't know anything, and there's a big problem. And for instance, we have seen that now there's this nice chainsaws to cut trees, and when you look at it in the TV, you say, oh, it's very easy to done. Oh, why should we pay somebody to do this? I will buy a chainsaw and I'll cut my trees by myself. But when you try to do it, you will realize, no, you can't do that, right? So similarly, like watching porn movies, and there's a lot of things. There are so many things when it comes to the sexuality, because the lack of knowledge in the male sexuality and female sexuality, the male sex cycle, then woman sex cycle, the anatomy of the vagina, the penis. So there are so many things. I think we should be talking about in a more detail, because there are so many other questions I think that we need to answer today. So I feel she should, as a couple with her partner, she should see somebody who's interested in what we call sexual dysfunction.
Okay, so doctor, can you also tell what's that specialist called?
So I mean, it depends on, like, so as I told you, so I do a little bit of that psychological, but then there are sometimes there is something called lack of libido. Now, for instance, somebody who doesn't even masturbate, they don't like sex at all. That's something a little bit high-fi. So we call hyposexuality. Then that's something the psychiatrist should go, because it's something, right? So sometimes it can be hormonal problems. So that's a different story. And sometimes abuse and things can happen, so that also can play a role. So we don't know her reason, because you have to really dig into the problem and then see what's happening. So my advice is somebody with interest in sexual dysfunction.
Right. Okay. And going to her next concern, is the abdominal pain after sexual intercourse normal, and what could possibly cause this, and when should they seek help?
So as I told you, now again, there are two types of sexual pain mainly. Number one is at the time of insertion, we call it superficial dyspareunia, or at the time of insertion there is pain. And there is something called deep dyspareunia, where with the deep penetration they have pain. Now usually deep dyspareunia is usually associated with a disease like endometriosis, adenomyosis, where we need to treat it. Whereas superficial dyspareunia is where the time of insertion is mainly psychological. So because that's a problem with relaxation. So depending on and then if she does deep penetration and have the pain, the abdominal pain, then it's more of endometriosis, or there's something she needs to have a scan and see what's happening there, or maybe ovarian cyst or something like that. But superficial dyspareunia, it's a psychological thing where needs counseling and practice and some psychological, what we call cognitive behavior therapy is needed.
Okay, so she was mentioning that the pain could last for a couple of days. So
Yeah,
that's still okay. All right.
possibly. Yeah.
Yeah, okay. Right, hold on. There's my question. I'm trying to find my question. All right. Thanks, doctor. I think you gave a very good explanation for whoever asked that question. And I really hope that now she knows that at least this is not a unique problem for her, but this is a very common problem that many females face. So the best would be to go and see a doctor with her partner itself. All right. So let's go and check our next question. This is asked in Sinhala. So මේ කාන්තාව කියනවා ඇයට වයස අවුරුදු 30ක් වෙනවා කියලා. ඇයට එක බබෙක් ඉන්නවලු. ඇය හදිසි අනතුරකින් අවුරුදු 3කට කලින් කොන්ද කැඩිලා ප්ලේට්ස් 2ක් සහ ඇන 6ක් කොන්ද මැදට දාලා තියෙනවා. එම අනතුරෙන් වම් කකුලේ බලලු කර ගාවින් පුපුරලා වෙන් වුණා කියලා සඳහන් කරලා තියෙනවා. ඉතින් ඇගේ ඔපරේෂන් එකක් කරන් පස්සේ ඇගේ කකුල නිතරම ඉදිමිලා තියෙනවා කියලා සඳහන් කරලා තියෙනවා. මේ කාරණා හේතුවෙන් ඇය අහන්නේ ඇයට නැවත වතාවක් ගැප් ගැනීමේ අවදානමක් තියෙනවද කියලා. ඉතින් වෛද්‍යතුමනි මේක මේ පොදු වැඩසටහනක් හින්දා සියලුම කාන්තාවන් දැනුවත් වෙනසේ අපිට පැහැදිලි කරලා දෙන්න. කියන්නේ මෙවැනි අනතුරක් සිදු වුණ අවස්ථාවකදී හරි ශල්‍ය කර්මයක් සිදු වුණ අවස්ථාවකදී හරි කාන්තාව ගැප් ගැනීමට සැලසුම් කරනවා නම් ඒ පිළිබඳව සැලකිලිමත් විය යුත්තේ කොහොමද කියන එකත් කියලා මේ කාන්තාවගේ ප්‍රශ්නෙට අපි පිළිතුරක් ලබා දෙමු.
Right. එතකොට අපි කියමු අපි සමහරට මේ ඇක්සිඩන්ට් එකක් ඉඳ වෙන්න ඇති ඕනම දෙයක්, ඒක ක්‍රියාතුරක් වෙන්න පුළුවන්, බිල්ඩින් එකකින් වැටලා වෙන්න පුළුවන් ඕන දෙයකින් අපිට අපේ අස්සිය හා සම්බන්ධ අනතුරක් සිද්ධ වුණාම අපි ඒ කියන්නේ ඒක ස්නායු අපේ කියන සුසුම්නාවට හානියක් වෙලා නැත්තම් ගොඩාක් වෙලාවට ලොකු ප්‍රශ්නයක් නැහැ. එතකොට අපි සාමාන්‍යයෙන් අපි ගන්නේ ඒ කාන්තාවට සෙක්ෂුවල් නැත්නම් එකතු වෙන්න පුළුවන් නම් බබෙක් හදන්න බැරි වෙන්නේ නැහැ කියන එක. ඒක පළවෙනි එක. ඒ වගේම තමයි අපිට සමහර වෙලාවට බබා පළවෙනි බබා නෝමල් හම්බ වෙලා මේ ඔපරේෂන් එක විශේෂයෙන් අපි කියන අපේ මේ මොනවාද පෙල්විස් එකට එහෙම නැත්නම් මොනවාද ශෝනි ප්‍රදේශයට හානියක්, ඒ කියන්නේ ෆ්‍රැක්චර් එකක් ඒ වගේ වුණොත් ගොඩක් වෙලාවට අපිට ඒ බබාව ඊළඟ පාර ප්‍රෙග්නන්සියේදී සිසේරියන් සැත්කමකට යන්න සිද්ධ වෙනවා. ඒතර අපිට සිසේරියන් සැත්කමකදී අපි සාමාන්‍යයෙන් කරන්නේ පොඩ්ඩක් ඉන්ජෙක්ෂන් එකක් දීලා අපි කියනවා ඉනින් පල්ලෙහා පාන්න නැති කරලා ඔපරේෂන් එක කරන එක, නැත්නම් මේ පපුව ප්‍රදේශ පල්ලෙහා පාන්න නැති කරලා ඔපරේෂන් එක කරන එක. නමුත් මේ වැනි අවස්ථාවල දැන් ඒ විශේෂයෙන් ඒකාන්තව ගතන කොඳුනාට ප්ලේට්ස් වගේ අතට අපි දන්නේ නැහැ කොතනද ඒක දාලා තියෙන්නේ කියලා. නමුත් එවැනි අවස්ථාවලදී අපිට සීසයකට යන්න වෙන්න පුළුවන් බබා ඩෙලිවර් කරන්න සීසයකේදී සී නැති කරලා සීසය කරන්න සිද්ධ වෙන්න පුළුවන්. ඉතින් ඒකට හරියට උත්තරය දෙන්න නමුත් දැන් අපි මොකද්ද වෙච්ච ඉන්ජරි එක කොච්චර දුරට ඒක ප්‍රශ්නයක්ද කියන එක බලා ගන්න ඕන. ඉතින් මොකද දැන් එයාගේ වලලුකඩ වල ප්‍රශ්නයක් වෙලා තියෙනවා කිව්වා, කොන්දේ ප්‍රශ්නයක් වෙලා තියෙනවා කියලා කිව්වා. එතකොට දැන් අපි දන්නවා කවුරු හරි කාන්තාව ප්‍රෙග්නන්ට් වුණාට පස්සේ නිකරුත් කොන්දේ අමාරු වෙනවා, අපිට අවද ගන්න අමාරු වෙනවා. ඒ වගේ ගොඩාක් දේවල් අපි සාමාන්‍ය සිම්ප්ටම්ස්. මේවයි කාන්තාවකට ඒ වගේ රෝගී ලක්ෂණ රෝගී වල සාමාන්‍ය ගර්භණී ලක්ෂණ ඊට වඩා ටිකක් සීරියස් විදිහට නැත්නම් ටිකක් මේ වැඩි සිවිරිටි එකකින් ඒ කියන්නේ ටිකක් වැඩි විදිහට ඒකට තේරෙන්න ගන්න පුළුවන්. ඒක කොච්චර දුරට බලපානවද කියන්නේ අපිට පොදුනාට පොඩ්ඩක් ඇද වෙලා තියෙනවා නම් හරියට පොස්ච් එක මේන්ටේන් වෙන එකත් එයාගේ බඩ ස්ටාර්ට් වෙනකොට අපි බඩ පොඩි ඇඟ කොන්ද නවලා තමයි අපි සෙන්ටර් ඔෆ් ග්‍රැවිටි එක හදාගන්නේ. ඒ වගේ අවස්ථාවලදී කොන්ද කැක්කුම මේ වගේ දේවල් වෙන්න පුළුවන්. ඒ නිසා හොඳ විදිය තමයි යාව ඔපරේෂන් එක ලක් කරපු ડોක්ටර්ත් එක්ක කතා කරලා කාන්න ඕනේ එයාට ඉස්සරහට ප්‍රෙග්නන්සි එකක් යන එකේ ලොකු ප්‍රශ්න තියෙනවා කියලා. නමුත් 99%කටම කිසි ප්‍රශ්නයක් නැහැ ප්‍රෙග්නන්ට් වෙන්න. ඊට පස්සෙත් ලොකු ප්‍රශ්නයක් නැහැ. බබා හම් වෙන එකට ප්‍රශ්නයක් විය හැකියි. නමුත් ඒවත් අපිට දැනට තියෙන විදිහට ලොකු ප්‍රශ්න නෙමෙයි. අපි උපරිම වුණොත් වෙන්නේ සීස් එකක් සී නැති කරලා කරන්න පමණයි. ඒක ලොකු ප්‍රශ්නයක් නෙමෙයි. අපි මේ වගේ අවස්ථාවේදී අපි කරන්නේ ඒ වගේ කාන්තාවක් අපිට ප්‍රෙග්නන්ට් වෙලා આવොත් අපි ඒකත් එක්ක කතා කරලා එයාව ඔපරේෂන් කරපු ડોක්ටර්ට අපි ලියුමක් දෙනවා. එයාට normal යන්න පුළුවන්ද, normal CC එකක් කරනවා නම් CC එකට හොඳට ඉන්ජෙක්ෂන් එකක් දෙන්න පුළුවන්ද කියන එක වහලා අපි අහලා ටෙස්ට් කරලා තියෙනවා. ඒකට හදිස්සියක් වෙලාවත් අපි ආයේ ඒගොල්ලෝ හොයෝ ඉන්න ඕනේ. අපි දන්නවා මොකද්ද එක්සැක්ට්ලි කරන්න ඕනේ කියන එක. ප්‍රශ්න නෙමෙයි.
හරි ඔබ කිව්ව වැඩිම වුණොත් සිසේරියන් සැත්කමක් කරනකොට සිහි නැති කරන්න වෙයි කියලා. තවත් එවැනි අවස්ථා තියෙනවද යම් කිසි කාන්තාවක් සිසේරියන් සැත්කමක් වෙනුවෙන් යනවා නම් සිහි නැති කරලා කරන්න ඕන වෙලාව?
ඒකට ගොඩක් අවස්ථා තියෙනවා. ඉතින් අපි බහුතරයකට කරන්නේ හොඳට ඉන්ජෙක්ෂන් ගන්න එක සේෆ් වෙන්න. නමුත් සමහරලාට තියෙනවා ලී වල රුධිර පට්ටිකයි තාම අඩු අවස්ථාවලදී අපිට සිහි නැති කරන්න වෙනවා. හොඳට ඉන්ජෙක්ෂන් ගන්න. විශේෂයෙන් ඒක platelet count එක ලක්ෂයට අඩු වුණාම අපි ටිකක් බයයි හොඳට ඉන්ජෙක්ෂන් එකක් ගහලා කරන්න. ඒ වගේම සමහරලාට හෘද වස්තුවේ ලොකු ප්‍රශ්න තියෙනකොට අපිට කරන්න බෑ. ඒ වගේම සමහරලාට අපි ඔපරේෂන් එකක් කරනකොට අපි කියනවා ගර්භාෂය පිටියටද මොනවාද වැදමා ඉතා තදින් ඇලිච්චත් අපි කියන ප්ලැසෙන්ටා පර්ක්‍රීටා ඒ වගේ අවස්ථාවලදී අපිට ගොඩක් වෙලා ඔපරේෂන් කරන්න වෙනවා. ඒ වගේම සීසන් සෙට් අපි සාමාන්‍යයෙන් බඩේ හරහාට කරන්න සමහරවිට මුල අර සර්ජන්ස්ලා කරනවා වගේ උඩ ඉඳලා පල්ලහැට දාන කැපුමක් දාන්න වෙන අවස්ථාවලදී අපි සී නැති කරලා කරනවා. ඒ වගේ ඉතින් හදිසි අපිට අපි ඒ වගේම දැනගන්න ඕනේ ස්පයිනල් එක නැත්තම් කොන්දට ඉන්ජෙක්ෂන් එක දෙන වාර 100ටත් 10කටත් අතර අවස්ථාවකදී ඒකට දෙන්න බැරුව අපිට සී නැති කරන්න වෙනවා. ඒකින්ද තමයි හැමතිස්සෙම සීසෙන් සෙට් කමට යනකොට අපි කියන්නේ කන්න බොන්න නැතුව යන්න කියලා. මේ නැතුව ස්පයිනල් ඇනස්තීසියා වලට කන්න බොන්න නැති ප්‍රශ්නයක් නැහැ. හැබැයි ඒක වැඩ කළේ නැත්තම් 1 in 100 to 1 in 1000 කියලා අපි කියන්නේ. ඒක වැඩ කරගන්න නැත්නම් ඉතින් ඊට පස්සේ කරන්න වෙන්නේ ඉතින් සී නැති කරන එක. ඒ වගේම අපිට ඊටාම ඉක්මනින් බබෙක් ගන්න සිද්ධ වුණොත් අපි කියනවා මේ යාගේ අපි කියන පෙකණි වැලේලිට අපුව අවස්ථාවලදී අපි කියන කෝඩ් ප්‍රොලැප්ස් කියලා. එහෙම නැත්නම් ඇබ්‍රප්ෂන් කියලා එකපාර වැදමා ගැලවිලා යනකොට අපිට බොහොම විනාඩි 5ක් 10ක් 15ක් ඇතුළත මේ බබා ගන්න අවස්ථාවලදී ඒකට ස්පයිනල් කරගෙන ඉන්න බෑ. ඉක්මනට සී නැති කරලා ගන්න.
හොඳයි බොහොම ස්තුතියි වෛද්‍යතුමනි කරපු දැනුවත් කිරීමට. ඊළඟ ප්‍රශ්නෙට යමු වෙමු. මේක ඉංග්‍රීසි වලින් අහලා තියෙන්නේ. She says she is 34 years old and has one 5-year-old kid. And she had tried to conceive for the past 2 years and have encountered 2 miscarriages, unfortunately. And she says her hopes for a baby has gone down due to this. So she'd like to know the reason for her recurrent miscarriages and whether it's possible to have another baby. So in answering this, please also explain the risk factors involved at present and what interventions might be recommended to a doctor.
Right. Okay. So miscarriages are common. Right, in what we say is 1 in 20 1 in 5 or 20% of the time when somebody, so there is a chance if somebody is pregnant, 1 in 5 chance of a miscarriage or 20% chance of a miscarriage, right? It's a sad situation, but now as doctors we know the reason. 99.9% of the time it's due to a chromosomal anomaly which is not compatible with life. Right, that is, we all have 46 chromosomes, which are the genetic material in our body, which has the plan for everything in our body. So we get 23 from father and 23 from mother. So any of these 1 to 23 has a problem, there's a chance of miscarriage. Now the only chromosomes which can kind of have a live birth or can see a heartbeat is trisomy, that is Down syndrome, which is chromosome 21 3 times. There is 18 and 13 also, where we see that the number, but they can survive till we get to detect them sometimes. But even those babies, 80% of them will have miscarriage before seeing the heartbeat. That's number one. Number two is that what you call so any of the other chromosomes, where if they have one less or one more, is not compatible with life. So that's the nature's way of dealing with abnormal pregnancies, right? And they go wrong most of the time. So to answer now she said now she's 34 years of age. You have to remember that as a woman, the best eggs are, I have been talking about this many times, that the best eggs are coming out from 20 to 30 years. Then the next set comes between 30 to 35 years. And after 35 is what we call the bad eggs are coming out. But for majority by 40 years, game over, right? But the chance of pregnancy become less and less and less. And the Down syndrome risk goes higher and higher and higher, right? So because of the older eggs. So and now this research has shown this many times, but sadly now, for instance, in Sri Lanka in 2017, about 100,000 women had a miscarriage. So you can imagine for 100 years there are so many reasons for miscarriages, and then sorry, so for 100 years there be like so many women has undergone miscarriage. So every life event is associated with a miscarriage. If they go to long distance traveling, going in cars, motorbikes, whatever, people say that's the reason. If you eat a fruit or whatever, home cooked meal or whatever, they say it's a miscarriage, right? So these are myths, right? The problem is when you think about those things, they become, there's guilt plays a role, right? And when you so they think, if I don't go on my trip or this trip, my baby is alive. My if I didn't eat this food, my baby is alive. So it's a myth. Even if she is on the bed without getting down ever, and even passing toilets on the bed and not eating any of those bad food or whatever, she still have it, because the faith of that pregnancy was decided on the day of conception, right? So and also the other problem is, regardless, even if we showed them that, look here, there is a problem with the fetus, there is an anomaly which is not compatible with life, for her, she has lost her baby. And the feeling, the sadness is equivalent to whether you lose a child or a young son or daughter. The feeling is the same. The only difference is the time that they take to come out of it.
All right. Thank you very much, Doctor, for shedding light on recurrent miscarriages.
Yeah.
Moving on to our next question, which has been asked in single, and it's quite a long question, paragraph, so I will just read it.
But Taruka, just one more thing I just forgot to ask, because now she asked about this recurrent miscarriages. There's a definition for that. Depending on the country, now for instance in States or USA, they take 2 consecutive miscarriages as recurrent miscarriage. And UK and other countries, we take 3 or more as recurrent miscarriages. Now, because it's common, and also each time now to answer a question like, okay, so if they, so we think it's due to natural causes, but if she has seen the heartbeat and the pregnancy has continued beyond 10 weeks, and if she loses a pregnancy or a miscarriage, because any pregnancy lost before 24 weeks is considered as a miscarriage. So she has not specified which time she has lost the pregnancies, but if that's the case, then we need to do a lot of investigation, because now obviously the chance of a partner or her having a genetic disorder is very rare, because she have a good child with them. But there are certain diseases which are especially with the blood, where we say that they are called thrombophilias, where their blood becomes thicker due to many diseases. They have a tendency for recurrent miscarriages. So in her case, if that's I would not think like that, because she has a 1 baby and 2 miscarriages. So I still think it's the chance is like throwing the dice, right? So when we throw the dice, the chance of 6 for falling is 1 in 6. You put it, do the next time, still it's 1 in 6. Third time is 1 in 6, right? So so each time the you get pregnant, there is 1 in 5 chance of a miscarriage, right? But if it is happening 3 or more times, then we think, okay, is there's problem, right? But again, majority of the time, nothing is found. But we take it a little bit more. And so to answer the question, can she get pregnant? Yes. Does she need investigation? It depends on whether she continued her pregnancy beyond 10 weeks and lost the pregnancy. Even 1, we have to do a lot of investigation. But if it is less than 10 weeks, and and especially if they have not seen the heartbeat ever, then she should try. But she should do the basic investigations for anybody planning for a pregnancy.
All right. Thank you very much, Doctor, for shedding light on that recurrent miscarriages. So moving on to our next question, which has been asked in Sinhala. Doctor, කියා සිටින්නේ ඇය වයස 36ක කාන්තාවක් කියලා. ඇගේ පළමු දරුවා සති 20ේදී පමණ ඇයට අදිරිදුර පීඩනය වැළඳී දරුවා නැති වෙලා තියෙනවා. ඉන් වසරකට පමණ පසු ඇය නැවත ගර්භණී වූ අතර දෙවනි දරුවා ලැබීමට සිටි මුල් මාසවල සිටම ඇගේ වෛද්‍යවරයා ඇයට ඇස්ප්‍රින් මිලිග්‍රෑම් 75 යන ඖෂධය ලබා දීලා තියෙනවා. නමුත් සති 26දී පමණ අදිරිදුර පීඩන තත්ත්වයක් නැවත වැළඳිලා තියෙනවා ඇයට. ඖෂධ මගින් ඒ තත්ත්වය පාලනය වූ අතර එම අවස්ථාවේ සිදු කළ ස්කෑන් පරීක්ෂණයට අනුව දරුවාගේ වර්ධනය බාලවීමක් සිදු වී ඇති බව වෛද්‍යවරයා පවසලා තියෙනවා. ඉතින් එහිදී වහාම රෝහල්ගත වන ලෙස වෛද්‍යවරයා උපදෙස් දුන්න අතර ස්කෑන් පරීක්ෂණය සිදු කර දින කිහිපයකින් පසුව දරුවාව සීස සැත්කමක් මගින් ලබා ගන්නා ලදී කියලා සඳහන් කරලා තියෙනවා. ඒ වෙනකොට දරුවාගේ බර ග්‍රෑම් 590ක් සහ සති 27යි දවස් 5ක් වෙලා තියෙනවා. ඉතින් ළමා රෝග වෛද්‍යවරුන් පවසා තිබෙන්නේ දරුවාගේ බර ප්‍රමාණවත් නොවීම නිසා දරුවාව ජීවත් කිරීම අපහසු වන බවයි. ඊට පස්සේ දවස් 5ක් පමණ බේබි කාමරයේ තිබෙදී දරුවා මිය ගිහින් තියෙනවා. ඒ දෙවෙනි දරුවා. ඉතින් වෛද්‍යවරු පවසා තියෙන්නේ ඇගේ වැදමහා හරහා දරුවාට ලබා දෙන පෝෂක හා ඔක්සිජන් නිසි පරිදි පරිවහනය නොවීම හේතුවෙන් දරුවාගේ වර්ධනය බාල වූ බවයි. ඉතින් ඇය අහන්නේ මෙසේ සිදුවීමට සහ ඇයහට මේ සඳහා ලබාගත හැකි ප්‍රතිකාර පිළිබඳව දැනුවත් කරන මෙන්. ඉතින් අපි මුලින් පැහැදිලි කරගෙන යමු වෛද්‍යතුමනි ගර්භණී අවස්ථාවේ ඇතිවිය හැකි අතිචුතර පීඩන තත්ත්වය පිළිබඳව. ඊට පස්සේ ඇයටත් පිළිතුරක් ලබා දෙමු.
ඉස්ලාමයේදී මම කනගාටු ප්‍රකාශ කරනවා ඒ කාන්තාවට ඒ කියන්නේ අපේ ජීවිතේ ඉතින් අපිට අත්දකින්න ලැබෙන ඉතාමත්ම නැත්නම් අපිට අත්දැකීම් දරුණුම මේ මොනවාද අපේ චිත්ත පීඩාවක් තමයි අපිට අපේ දරුවෙකු නැතිවීම. ඒ නිසා ඉතින් මම එයාගේ මානසිකත්වය මට හිතා ගන්නවත් බෑ. ඉතින් ඒක ඊටාම කනගාටුදායක එකක්. නමුත් ඉතින් අපි එයාට උත්තරයක් දුන්නොත් අපි ඉස්සලම තාරුකායි ප්‍රශ්න උත්තරයක් දුන්නොත් අදිරික පීඩනය කියන එක අපේ දැනට හොයාගෙන තියෙන අපි තාම දන්නේ ඇයි ඒක වෙන්නේ කියලා. ඒ කියන්නේ අපි දන්නේ වැදමහාට යන ලේ ප්‍රමාණය අඩු වෙනවා කියලා. නැත්නම් වැදමහා ගර්භාෂය පිටියට මොනවාද ඇලීමේ ඇති වෙන ප්‍රශ්නයක් හින්දා තමයි මේ ප්‍රෙෂර් එක වැඩි වෙන්නේ කියලා. ඇත්තට මේ ප්‍රෙෂර් එක වැඩි කරන්නේ බබාගෙන් නිකුත් වෙන අපි කියනවා මේ සයිටෝකයින්ස් කියලා. එහෙම නැත්නම් රසායනික ද්‍රව්‍ය මගේ ඒවා ප්ලැසෙන්ටා වරා අම්මගේ රුධිරයට ගිහිල්ලා බබා try කර ගන්නවා එයාට ලැබෙන ලේ ප්‍රමාණය වැඩි කරන එක. අපි මිදුලට මේ වතුර දාන හෝස් එකකින් අපිට ටිකක් ඈතට වතුර දාන්න හෝස් එක දිගමදින නම් අපි ඒකේ කට පොඩ්ඩක් පුඩි කරපුවම වතුර ටිකක් ඈතට විදිනවා. ඒ වගේ දෙයක් තමයි බබා කරන්න බලාපොරොත්තු වෙන්නේ අම්මගේ ඒ සංඝටනයේ අම්මගේ රුධිර වාහිනී සංකෝචනය වෙන්න ගන්නවා. නමුත් ඒකේ ප්‍රශ්නේ තියෙන්නේ ඒක වෙනකොට අම්මගේ මුළු රුධිර වාහිනී පද්ධතියටම හානියක් සිද්ධ වෙනවා. එතකොට රුධිර වාහිනී වැඩියෙන්ම තියෙන අවයව ඒ කියන්නේ පටන් ගන්න වකුගඩු වලින් අක්මාව අන්තිමට මොළයට යනකම් ඒ මොනවාද හානිය වැඩි වෙන්න අම්මගේ ජීවිතේට හානියක් වීම සම්භාවිතාවක් තියෙනවා. ඉස්සර අපි කියනවා එක්ලැම්ප්ස් එහෙම නැත්නම් ෆිට් එකක් හැදලා අම්මලා නැති වෙනවා කියලා. නැත්නම් ප්‍රෙෂර් වලින්. ඒ නිසා අපිට ඒ වගේ අවස්ථාවක් වුණා අපි හැමතිස්සෙම වැඩ කරන්නේ අම්මගේ ජීවිතේ එක බබාගේ ජීවිතේ දෙක කියලා. ඉතින් අර ගිය පාර කියලා තිබ්බ සති 20දී යාට කළා ඒක මේව කරන්න උනා කියලා. ඒ වගේ තමයි මේ ඒ ප්‍රෙෂර් එකෙන් අපි තාම හේතුව දන්නේ නැතුණාට ඒකට කියෝ එක වෙන්නේ බබාව අයින් කරන එක කියලා. ඒක නැත්තම් අපි කියන ප්ලැසෙන්ටා වැඩ කරන. ඒතර ඒක සමහරවිට බබා නැති වෙලා වෙනවා. එහෙම නැත්නම් අපිට වේලපයින් බබා අරගෙන කරන්න සිද්ධ වෙනවා. ඒතර දැන් එයාගේ කියපු රෝගී ඉතිහාසය ගත්තම එයාට පළවෙනි බබාට සති 20දී ප්‍රෙෂර් එක ඇවිල්ලා තියෙනවා. ඒ වගේම තමයි පළවෙනි පාර ප්‍රෙෂර් එක ආපුවම ඊළඟ පාර 80%කට වැඩි chance එකක් තියෙනවා ඒ ප්‍රෙෂර් එක ඊට වඩා දරුණු විදිහට සහ ඊට වේලපයින් ඇවිල්ලා ප්‍රශ්න ඇති කරා. ඒ වගේම බබාලා කුඩා වෙන්න, බබාලා බඩ ඇතුලේ නැති වෙන්න, එහෙම නැත්නම් වැදමා වේලපයින් ගැලවෙන්න, ඒ වගේ ගොඩාක් ඒවට රිස්පෙක්ට් එකක් තමයි අදිරුධිර පීඩනය කියන්නේ. ඒකෙත් ඊට ඉස්සෙල්ලා ප්‍රෙග්නන්සි එක තිබුණොත් ඇත්තම කියනවා ඊළඟ ප්‍රෙග්නන්සි එකත් නෙමෙයි තමන්ගේ අම්මට හරි තමන්ගේ සහෝදරියකට ගර්භණී අවස්ථාවේදී ප්‍රෙෂර් එකක් ඒ වගේ ප්‍රෙෂර් එකක් තිබ්බනම් ඒක එයාගේ දැන් එයාටත් ඒක ප්‍රෙෂර් එකක් වීමේ රිස්ක් ෆැක්ටර් එකක් වෙනවා. එතකොට දැන් එයාගේ දෙවෙනි බබාට එකම මම එතන මම ක්‍රිටිසයිස් කරන්න කැමති නෑ. නමුත් අපි සාමාන්‍යයෙන් දැන් සති කාට හරි ප්‍රෙෂර් එකක් ඇවිල්ලා තියෙනවා නම් ලොකු ප්‍රශ්නයක් වෙලා නෑ. බබා හොඳට ඉන්නවා ප්‍රශ්නයක් නෑ. හැබැයි ගර්භණී අවස්ථාවේදී ප්‍රෙෂර් එක ආව නම් අපි ඊළඟ ප්‍රෙග්නන්සියේදී ඇස්ප්‍රින් කියන ප්‍රතිකාරය පටන් ගන්නවා. ඒක ඇස්ට්‍රික් ට්‍රයල් කියලා ලෝකේ ගොඩාක් රටවල් අරගෙන කරපු ට්‍රයල් එකක් හම්බුණා. අපි දැන් මම කිව්වා 80% chance එකක් තියෙනවා එන්න කියලා. ඉස්සෙල්ලා ප්‍රෙග්නන්සියේදී ප්‍රෙෂර් ආව නම් ඒ වගේම ඇස්ප්‍රින් කියන ඔසුව පාවිච්චි කළොත් සති ඒ කියන්නේ අපි කියන්නේ සති 12 සිට බබා හම්බ වෙනකන් ඒක පාවිච්චි කළොත් 80%කින් වළක්ව ගන්නත් පුළුවන්. නමුත් මෙතනදී මෙයාගේ රෝගී ඉතිහාසයේ පොඩි දේවල් දෙකක් තියෙනවා. ඒක තමයි අපි කියනවා සති 20 දී ප්‍රෙෂර් එක ඇවිල්ලා බබා නැති වුණා කියලා. ඒ අවස්ථාවේදී අපි තව හොයන්න ඕන ඇයි මෙයාට මේ ප්‍රෙෂර් එක ආවේ කියලා. එතකොට එයාට පරීක්ෂණ මාලාවක් සිදු කරන්න සිද්ධ වෙනවා. ඒ පරීක්ෂණ මාලාවේ එකක් හරි පොසිටිව් වුණොත් අපිට එයාට ඇස්ප්‍රින් වලට අමතරව ලේ කැටි ගැහෙන එක අඩු කරන්න කියලා බඩවැට ඉන්ජෙක්ෂන් එකක් වෙනත් අපි කියනවා ලෝ මොලිකියුලර් වේට් හෙපරින් කියලා ඉන්ජෙක්ෂන් එකක් තියෙනවා. ඒකත් ගන්න. ඒක අපි බබාගේ හાર્ට් බීට් එක දැක්ක දවසේ ඒක ගොඩක් වෙලාවට සතිය 7 ඉඳලා බබා හම්බ වෙනකන් අපි මේවයි කාන්තාවකට අපේ ප්‍රෙග්නන්සි කන්ටිනියු කරන්නේ සති 37 වෙනකන් විතරයි. මුකුත් ප්‍රශ්නයක් තිබුණ නැත්තම් ඒ 37 වෙනකම්ම හැමදාම ඉන්ජෙක්ෂන් එකක් දෙන්න ඕනේ. ඒකෙන් සහ තව දේවල් 7ක් තියෙනවා කරන්න. ඒ දේවල් 7ම කළොත් 7න් අඩුම ගානේ 6ක් කළොත් 100ට අපි ඒ කාන්තාව අනුව තමයි අපි තීරණය කරන්නේ කොච්චර ඒ 7න් කොච්චර දේවල් කරනවද කියන එක. නමුත් ඒ කළොත් 180ක chance එකක් තියෙනවා ඒක වළක්වලා බබෙක් අරන් ගෙදර යන්න. ඒතකොට එයාට දෙන්න පුළුවන් උත්තරේ තමයි ඔව්. එයාට බබෙක් හදලා ගෙදර අරන් යන්න පුළුවන්. රිස්ක් එකක් තියෙනවා. දෙවෙනි පාර දැන් තුන්වෙනි පාර ඊටත් වඩා රිස්ක් එකක් තියෙනවා. නමුත් අපි අවශ්‍ය ඒ ප්‍රතිකාර ටික ඔක්කොම කළොත් එයාට 180ක chance එකක් තියෙනවා බබෙක් අරන් යන්න ගෙදර. හැබැයි මේක කම්පෙයාර් කරන්න ඕනේ අනිත් කාන්තාවට 98ක chance එකක් තියෙනවා. කොහෙවත් ලෝකේ 100ක් බබලා යන මේකක් නෑ. නමුත් කිසිම ප්‍රශ්නයක් නැති කාන්තාවට 98ක chance එකක් තියෙනවා බබෙක් අරන් ගෙදර යන්න. මේ කාන්තාවට 180ක chance එකක් තියෙනවා බබෙක් යන්න හරි ප්‍රතිකාර තුලින්. ඒ නිසා ඉස්සෙල්ලාම එයා කරන්න ඕනේ ගොඩක් ස්පිතාලවල ඔය recurrent miscarriages වලට තියෙන ක්ලිනික් එකක් තියෙනවා. එහෙම නැත්නම් ඒ වගේ තැනකට ගිහිල්ලා ඉස්සෙල්ලා පරීක්ෂණ මාලාවක් කරන එකේ සමහර දේවල් අපිට රජයේ රෝහලින් කරන්න පුළුවන් නොමිලේ. හැබැයි සමහර දේවල් අපිට තාම රජයේ රෝහලින් කරන්න බෑ. ඒවා ප්‍රයිවට් කරන්නත් සිද්ධ වෙන්න පුළුවන්. ඒවා ටිකක් මුදලක් වැය වෙන පරීක්ෂණ ඒ ඔක්කොම කරලා ඊට පස්සේ ඒවා ගැන දැනගෙන තමයි ඊළඟ ප්‍රෙග්නන්සියට යන්නේ. ඒ වගේම ඊළඟ ප්‍රෙග්නන්සි එකපාර මේ දැන් ප්‍රෙග්නන්ට් වුණාට මේ ඔක්කොම ප්ලෑන් කරලා බෙහෙත් සමහර බෙහෙත් අපි ප්‍රෙග්නන්සි ඉස්සෙල්ලාම පටන් අරන් කරන දෙයක් තියෙනවා. ඒ ටික ඔක්කොම කරලා ඉතින් එයාටත් කැපවීමක් කරන්න වෙනවා. ඒ වගේම එයා බලා ගන්න කවුරු හරි ડોක්ටර් කෙනෙක් ඉන්නවා නම් එයාත් යම් කැපවීමක් කරලා තමයි බබෙක් කරන් ගෙදර යන්න පුළුවන් වෙන්නේ.
හොඳයි, බොහොම ස්තුතියි වෛද්‍යතුමනි. අවාසනාවන්ත සිදුවීමක්. නමුත් බලාපොරොත්තු වන ඇයට නිසි මඟ පෙන්වීම යටතේ ඉක්මනින්ම දරු පිළිසිඳ ගැනීමක් සිදු කරගන්න පුළුවන් වෙන්න කියලා. ඒ වගේම එහෙමනම් වෛද්‍යතුමනි ඊළඟ ප්‍රශ්නෙට යමු. මේක අහලා තියෙන ඉංග්‍රීසි වලින් මේකත් මේ අධිරුධිර පීඩනය හා සම්බන්ධ ප්‍රශ්නයක්. So this lady is asking if she can continue to take Conquer 2.5 milligram, which is a beta blocker drug known as bisoprolol, and Tel-Day 40 milligrams, also known as telmisartan, and vitamin D for hypertension while trying for pregnancy.
Right. So it's like this. Now now bisoprolol is a beta blocker, as you said, but now usually we don't start it for hypertension unless there is a problem with the heart. So now bisoprolol is a drug that we don't like to use in pregnancy because it can have problems with baby's weight gain. Babies can become smaller and something called fetal growth restriction and things can happen. However, if the risks or the benefits outweighs the risk, then we tend to use it, especially women who have serious condition in the heart. We continue bisoprolol during pregnancy and we closely monitor the baby. So that's number one. And the second drug, which is ACE inhibitor, is contraindicated in pregnancy. So she should not continue that drug while trying for a baby. Now the vitamin D can be taken. There's no issue there. But the important thing is now, if somebody is having a medical disease, whether it's high blood pressure, diabetes, or any medical disorder, now before getting pregnant, they should go to something called a pre-pregnancy counseling, right? So where a doctor will go through a history, see what are the how, if there is a medical disease, what is that medical disease, how severe is that disease, whether there has been any effect. Now for instance, when somebody is saying high blood pressure, their heart can have issue sometimes. Because of a heart condition they can have a high blood pressure, so we don't know what's the reason. So during this preconception counseling, number one is, if somebody, we will decide whether she is ready for a pregnancy. And if she's not ready for pregnancy because either the disease is not under control, then we have to control it. And if she's under control but she's taking medicine which can harm the baby, so then we write to her original physician and say that she's planning for a pregnancy, to change the medication. So a lot of doctors will change it to more pregnancy friendly medication, but during that time she should not get pregnant until we control the disease, right? And then, and sometimes until such time she should be using a proper contraception. And very rarely we might have to tell you here, because of your heart condition or because of your this condition, you should not ever get pregnant, because the chance of that woman dying or having serious consequences during pregnancy is very high. So in that case, we will tell the woman here, you should not. Like for instance, there are certain heart diseases where unless we treat them, they have more than 80% chance of dying during pregnancy. So though reproductive production is a right and a basic human need, and somebody has to decide whether that's worth dying in a there where we can, there are other ways of getting pregnancies nowadays. So the important thing is to go and for her, because bisoprolol is a bit of a serious drug. We don't start for high blood pressure, because it's not due to high blood pressure, where something has to be doing with the heart or something like that. So they have to know why is it given and all that, and then control all that, change her drugs if necessary, and mainly to see whether she's fit for pregnancy first. If fit, then do all the other changes and then embark on the pregnancy.
All right, thank you very much, Doctor, for shedding light on hypertension management. Moving on to our next question, it's also regarding pregnancy planning. So our next two questions revolve around pregnancy and vaccination. I'm not sure whether this was sent by the same person or two people, but I feel that it might overlap the answers. So I will ask both questions together and then we can answer one by one. So the first one is rubella vaccination a must prior to planning for pregnancy, provided the antibody test came negative? And then another lady, or maybe the same lady, we don't know, has asked, what's the waiting period after rubella vaccine to try and conceive? So, doctor, before answering these, please explain what rubella infection is and its prevalence in Sri Lanka, and whether any demographic or regional people are at high risk in Sri Lanka for rubella infection, and then answer the question.
Right. Okay. So number one is it's highly recommended that if somebody's rubella antibodies are negative, to get the rubella vaccine, and after vaccine you have to wait for 1 month before getting pregnant. It's not 3 months like before stated. Only 1 month is needed, and after that you can embark on a pregnancy, because having rubella during pregnancy, especially in the first 3 months, can be detrimental. In fact, in other countries, if you get rubella in the first trimester or first 3 months, is an indication for termination of pregnancy, because there's a very high chance that, or more than 80% chance, baby can get affected with rubella, which is congenital anomalies. They have hearing problems, anomalies, and so many things. So termination is recommended. And after 12 weeks, the chances of having issues are less. But because this can happen at any time, we encourage them to get the rubella vaccine if the rubella IG, or what you call the antibodies, are negative. And in Sri Lanka, what we do is, if they are not sure that whether they have taken the vaccine, because rubella IgG uh, test is very expensive, we ask them to take the vaccine, because even if you had the vaccine and you have forgotten about it and you are getting the vaccine, there's no harm. So ideal way is to do the rubella antibodies, see whether somebody has either got vaccinated or got the disease before. If it is positive, that's what we say, that it's immune for life. And then after, if it is immune, then nothing, no problem. If the antibodies are not there, get the vaccine, wait for 1 month, and then start for the baby.
So if they have got the disease before, then they don't need to get vaccinated?
No.
Okay, all right. And can you also please quickly tell whether the partners need to be vaccinated as well? And also, like, even for the female, how many doses are recommended before trying to conceive?
It's only one-off dose.
One dose, all right.
Yes,
all right. And then what are any potential risks associated with trying to conceive before the recommended 1 month period? Are there any implications to the mother or fetus?
Right. Okay. So now theoretically, because it's a live attenuated vaccine, that means we give the live vaccine. There is a chance of baby getting affected. However, so far, there have been many instances where people have got conceived while soon after rubella vaccine, and so far, none of the pregnancies has been affected by rubella vaccine. So though we say that wait for 1 month, which is the recommended for any live attenuated vaccine, so far no reported case in the world for rubella syndrome after vaccination. So if you had it, don't. If you get pregnant accidentally, and then don't worry too much, because you will be the world first case. Right?
All right. Okay, thank you, doctor, for shedding light the importance on the rubella vaccine before trying to conceive. So moving on to our next question, is foreign travel, in brackets it says for work reasons, allowed during the first trimester?
Sorry, come again.
Is foreign travel?
Oh, right. Yes, right. Okay.
Yeah.
So now I usually tell women when they are pregnant, you're pregnant only, it's not a disease. Right? So it's people used to deliver in the jungle without any of the doctors, hospitals, nothing for the last 10,000 years, right? And human race propagated Earth, right? Only 10% will need our help, because either baby or mother goes home because of us, right? And there is nothing you can do or not do to prevent you falling into that 10%. It's beyond you. So you can travel abroad, you can travel long distances, you can go on motorbike, cars, three-wheelers, boat, planes, bumpy roads, mountain roads, right? You can eat seafood, you can climb stairs, you can do exercises. So nothing much, right? So because, as I told you in the beginning, we are miscarriages, because it's very common, and people have formed myths regarding miscarriages, right? And if you go on a long distance, you had a bleeding, that's the reason. Even if you're on the bed, it will happen. But because this happened, and over the period of thousands of years, that people form ideas, because we like to blame ourselves for whatever reason, right? So it's nothing to do with you, because I told you miscarriages is due to thing. Now the only thing is, now when when you are flying, you have to make sure that your pregnancy is inside the womb, because there is something called ectopic pregnancy. If it ruptures while you are air, you're going to die, because there's nothing can be done unless there's a emergency landing. If you're in the sea, or you're passing through the sea, then it cannot be done. So that can kill a woman very quickly. That's number one. Now, if somebody has a very high risk of preterm labor, now not 12 weeks, first trimester is very safe. But if it is beyond that, let's say somebody had a earlier preterm labor and all that, then not because you are air traveling, but if you are on the plane or in the plane, and then you start the contractions, then very little can be done in the plane if you're premature. Obviously, there have been instances where women have delivered in the plane and there's no issues. Now that is the reason most of the airlines will allow only 36 weeks, up to 30 weeks to travel, because after the 6 weeks there's a chance of labor, and then you have to deliver inside the plane, or you have to do emergency landing, because a lot of airlines will not like it. So to answer her question, briefly, yes, there is no restrictions whatsoever for air travel or anything, right? During the first trimester, once you see the heartbeat, and you know that your pregnancy is okay. Okay.
Yes, you talked about this in depth in one of our What Matters to Her episodes as well. So that's also there on our Facebook page. But very quickly, doctor, when doing overseas travel, assuming that people would probably stay in hotels and everything, are there any certain types of food or drinks that should be avoided, like raw meat or stuff? And whether there are any vaccines to be taken as well if they are pregnant?
Right. So it depends on the country they're traveling. So there are certain, restrictions, like, and some countries will need certain vaccinations. So some of the vaccinations are live veterans, so they can't get it in pregnancy, so they can't travel. And when it comes to food, as I told you, no restriction, right? As long as they are clean and healthy, in the sense, now, for instance, sushi, right? So, I mean, if you eat from Japan or whatever, it's properly made, then it's fine. But then it's a raw thing, and if you get a diarrhea and all that problem, yes, that can be an issue. The only thing you are not supposed to take is alcohol or coffee during pregnancy. That's all.
That
Apart
has
from
nothing to
that,
do with traveling, but anytime, right? During
anytime.
pregnancy.
Yes.
Yes. All right, cool. Thank you very much, doctor. We do have two more questions, but before that, we have a question from one of our viewers. So she's asking, are there any preconceptional council in Sri Lanka?
Of course, there are. Right. So it's like nowadays, even most of the hospital will runs clinic, because we have discussed about this, because the need for preconception counseling in Sri Lanka. The main reasons are a lot of women are postponing pregnancies, and we see that's number one, because a lot of people are postponing their pregnancies beyond 30 nowadays. Number two is that the non-communicable diseases, that is like hypertension, high blood pressures, a lot of other diseases are seen at a younger age than our ancestors. Like earlier, diabetes is older generation disease, but now we see young, and we see young heart attacks. 30 years, 32 years, people are dying from heart attacks. So because of that, we should be looking at this. And second thing is, uh, we don't make many children now, and we want everything to be perfect. So the best thing is, like, now, you go to a place and you say, okay, now I'm ready for pregnancy, and you have to have everything perfect to go on a pregnancy, right? But sadly, people say in Sri Lanka, people check only two things before buying, that is a car and a toilet. Right? They will go and with a bus and go around the car and do all those little things and say this car is better. But they embark on a pregnancy, and obviously most of the Sri Lankan will sell the car if there's something wrong with something to another person. But you can't return babies, you can't terminate pregnancies in Sri Lanka in a legal way. So the best thing is, when you're ready, like, prepare yourself, go and do the needful, do the proper investigation, start your folic acid before, and if there are any controllable things and you can change things, do that first before getting pregnant.
Thank you very much, doctor. And we do have another viewer asking, saying that she wants to meet you and get advice. So just for all our viewers, our doctor is a consultant obstetrician and gynecologist at the Disoisa Hospital for Women, and he's also doing private channeling at Nine Wells Hospital. And what else? Joseph Fraser and King's Hospital, I believe.
Yeah, Lankan.
Yes. All right. Okay. So moving on to our next question. Hypertrophic elongation of cervix, is this rare, and what negative effects can it have on a pregnancy? So please explain what hypertrophic elongation of cervix is, and then answer the question as well.
Right. So hypertrophic elongation is like there's a length of the cervix, which is the neck of the womb, but some women, because of a change in this neck of the womb, it starts growing. So it's sometimes come out even from the vagina, right? The problem with that is, number one is the sexual problems. Number two is, obviously, then the sperm has to swing far, and then there can be problems with conception and fertility. Apart from that, not a major issue. They have not known to cause preterm labor. Actually, in fact, they are protected from preterm labor. And sometimes it can be a problem for vaginal deliveries if they get pregnant. Apart from that, no major issues.
So you were saying it can be a problem for vaginal delivery. So does that mean that they should go for a planned C-section? And if so, at what week, which week?
Yeah, so normal, like yes, a lot of people will be going for a cesarean section, but it's not a absolute contraindication. It depends on at the time of the delivery, what is the status of the neck of the womb. Cesarean sections done in Sri Lanka, usually if there's no other complication, is between 38 to 39. In the Europe, it will be 39 to 40.
All
Unless
right.
there are
Thank you very much,
complications.
doctor.
Yeah.
Thanks, doctor, for shedding light on hypertrophic elongation of cervix. And moving on to our final question, what are the suitable exercises to ease a normal delivery, when to start, and the required duration per day? So when you answer this question, doctor, please elaborate if there are any precautions or contraindications to
Right.
consider before starting an exercise routine as well during pregnancy.
Right. Okay. So now there are now to kind of to be a little negative, but none of the exercises has shown to have major effect on easing the vaginal birth by research. However, right, doing exercise is always beneficial. Now, for majority of the women, the problem when it comes to vaginal deliveries, the abdominal muscles are not there, right? So because that you have to push and the pressure has to go down, but when the uterus contract, it comes from the tummy, not from the because you have to remember that the least resistant pathway will be taken. So majority of the Sri Lankans, the abdominal muscles are very very low, right? Because no exercises at all, right? I mean, we hardly walk most of the time, right? So that is the reason when long years ago, when we were, like when we had hardships in day-to-day living, people didn't have any problem giving birth. Right now, because of our sedentary lifestyles and all that, the babies has become bigger, and the abdominal muscles has become less, and all these are not beneficial or are negative factors for vaginal delivery. Now you can do like what I usually tell is you go to YouTube, search for exercises, because these exercises are varied, because you have to go through them and see, oh, this one I can do, this one I can't do, because there can be very very demanding exercises to very easy ones, and it depends on the person, because I had a patient who runs a fitness center. Now at 32 weeks she's doing weights and running and doing dips. I can't even come close to her at 32 weeks. I can't run with her basically, right? She's very very fit, right? And I've seen women who are surfing in pregnancy, right? So it depends on your fitness and how well you do it, but you're not going to do something crazy during pregnancy and sprain your neck or muscle, because the body is not adjust as well. So usually you have to do exercises during pregnancy. Only difference is you listen to your body, right? So usually what we do is, let's say we do 10 push-ups. At 8 you are really struggling, but you will try somehow to do to 9 and 10 if you want to do 10. In pregnancy, when you are at 8, you're tired, you stop it, and after about half an hour you can still do the next two. You don't push yourself too far in pregnancy. And go to YouTube, search for the exercises for making birth easy. Go and do something which is appropriate to you culturally, more rather than culturally, usually, you for your limit, that's all.
All right, great, doctor. So you were saying don't push too much, too far. So
Yeah.
on that note, I was also wanted to know because some women during pregnancy, they also want to control their weight and their body figure. This is nothing to do with the gestational diabetes, which has a different topic altogether. So in that instances as well, what should they be mindful of when they consider diet plans? And some women are also, they are like after childbirth,
Yeah.
immediately they want to lose all that weight as well. Is that really a good thing to do?
Right. Good question, actually. So I'm with those women. My practice, because what I believe is, because our bodies, now majority of the Sri Lankans, the statistics says 80% of Sri Lankans will never lose weight what they gain during pregnancy and the breastfeeding time, which is the first year of baby's life, because our culture says eat for two people and all that kind of thing, right? What happens is, uh, we have an unlimited storing capacity, right? And our body doesn't know that we can have food whenever we want now in the modern world. But our body is stuck 10,000 years before. So whatever it's given to it, it stores, thinking that it will not get the next meal. So now I usually say, if you are like, if your mother or your, rather than you, like your elders say that, okay, eat for two people, on your way you have to buy a cow also, right? At 4 a.m. you have to get up, milk the cow. Most of the time, by the age of that one is pregnant, there should have been about 4 kids. You have to go to the river, bathe them. You have to, what you call, hena potanna, and all the household chores. And in a country like in Sri Lanka, where we call it, it's a male dominant society in that time, where the husband eat first, the kids eat first, then the mother, lastly mother. And now, by saying that you can eat for two people, the husband might give the food to the wife, because she's pregnant, in a time where the food was scarce. But nowadays we have remembered to eat for two people, but we are on the bed looking at Facebook and eating for two people, and it has gained weight only, right? So that's, and sadly, you will the chances of not losing weight is more than 80%, and 15% will lose a little, but never to pre-pregnancy. So the 95% of the time, the chances are, once you're pregnant, you will be more than your pre-pregnancy weight for life, and it's cumulative. First baby 20 kilos, second baby 20 kilos. Before marriage, figure is like 300 milliliter Coca-Cola bottle. First baby 1 liter, second baby 2 liters for life, right? So it's not. So I always encourage people to kind of restrict like carb intakes. And I mean, the only thing is, you have to remember, the baby's food is carbohydrate, so you can't go for zero carbs. You have to eat healthy, and starving is a problem, because with starving increases something called ketone bodies, and that is the thing, what you call ketonic diet. So the ketone bodies increase, that is harmful for the baby. So during pregnancy, fasting is something you should not be doing. And then you have to eat small frequent meals. I usually say, eat whatever you ate when you're non-pregnant in half meals, right? So, for instance, if you eat 4 slices of bread for breakfast, eat two, wait for 2 to 3 hours, and then eat the next two. So, use 6 meals per day, but half of what you eat normally. That will maintain your figure, maintain your weight, no problems for the baby. Baby will gain weight, no issues at all.
All right, thank you, Doctor.
Yeah,
Two more
okay.
questions from the audience
Right.
quickly.
Right.
So one is, can a lady who has had chemotherapy for breast cancer about 5 years ago cause birth defects in a newborn? Any precautions to be considered?
Very unlikely, right? And only thing is, now sometimes the eggs get damaged during chemotherapy, because some of the chemotherapy agents are cytotoxic, and then they harm the eggs, and it reduces the what you call the egg reserve, right? And depending on how long and what is the dosage, sometimes it can harm all the eggs, and there's no chance of fertility afterwards. In fact, most of the time, depending on the therapy regime plan, unless it's absolute necessary, we do something called eggs preservation, where we give a medicine, get the eggs out, freeze them. We can freeze them for 20 years now. So if plan, or if they are, let's say they have a partner or husband or whatever, we make embryos and like IVF, freeze them and keep them until the whole thing is over, and then when you're ready for a baby, to do the implantation, right? The embryo transfers, right? Or eggs and do the IVF, right? So to answer that, we can't say 100% no also, right? Unlikely, but the more chances of it's already the reserve is low and then there's a problem can happen. So best thing is if the time permits, because sometimes the cancer is like we have to treat it very quickly. There's no time to get the eggs out. But if there's time permits, then we call it fertility preservation methods has to be discussed.
All right, thank you very much, Doctor, for shedding light on that as well. And one last question from the audience. So she's saying, "Hi, Doctor. Just wanted to ask: is a tetanus shot is necessary while pregnant? Her doctor said it's not necessary, and I don't live in Sri Lanka, so appreciate your answer."
It's correct, first of all, and even in Sri Lanka now we're trying. Okay, so basically the reason for tetanus toxoid is to prevent neonatal tetanus. Even in Sri Lanka, the last case of neonatal tetanus was reported about 35 years ago, right? So then one can question why we're still continuing tetanus toxoid, in our what you call EPI, or what you call the National Immunization Program. So the reason is now majority of the rural areas, or like the women they keep the babies on the floor, on their the mats and all that, and there's a chance of insect bites, pets like cats and dogs and bitten, or even scratches and all that, and that's a indication for tetanus immunization. But sadly, when the babies are less than 2 months, the babies cannot develop antibodies, so there's no point giving the injection for majority of the time. So the baby is protected only from the antibodies which transferred to the baby at the time of pregnancy. So whatever the diseases the mother has immunity will pass through the placenta by something called antibodies called IgG to the baby, which protects the baby until the baby is ready for immunization. So the first injection goes in 2 months time when the baby is 2 months. So until that, there's some protection, and that is the reason we continue tetanus toxoid immunization in pregnancy. So if the only time we don't give it is if there is recent immunization, or she can prove that she has taken the whole the national immunization as a child, because a lot of women will the girls at 12 years injection will be missed because they are scared of injection, and now they are big enough to say no and not to do that, right? So that's the reason.
All right, two follow-up questions. So you were saying recent immunization. So how recent are you talking about? And also, like, how many doses are required?
Yeah, so usually in the current program, if you're first time and you can't prove that you have taken the whole injection, we give 2 injections 6 weeks apart, starting from 12 weeks upwards, and subsequent pregnancies we give 1, right? So if it's a year in between the injection or 2 injection and the pregnancy, we don't need to give it again.
All right. Thank you very much, Doctor. With that, we come to the end of our third live virtual drop-in session with Dr. Probhodana Ranaweera. And as always, Doctor, on behalf of all women who watch these episodes and benefit from this, I would like to thank you for generously dedicating more than an hour to educate and provide invaluable information on women's health and pregnancy-related concerns. And your dedication to empower women through knowledge is truly commendable. So thank you very much, Doctor. And I would also like to thank all the ladies who sent their questions and concerns to us, because you're not helping only yourself, you're also helping to empower other women who may be going through similar questions in their minds. So thank you very much. And ladies, remember, empowerment begins with education. And by staying informed, you are helping yourself and those around you to lead a better and a healthier life. Until we meet next time, take care and stay well.
So thank you, Taruka, once again. And also now this is not possible if it's not because of Taruka, because I don't know all these gadgetics and all that things, how this works and all that. So she lives in Australia, and I don't know what's the time there now. Is it 11:30 or
12,
right? So it's young, it's still early night in Sri Lanka. But thank you very much for doing that. I think this has helped many women, and when I see patients, they always say that they watch this and they have got a lot of education and knowledge from this program. So I think you are doing a great service. Yes, I spend time, but you are the one who's doing all this behind. So thank you
Thank
very
you,
much
doctor.
once again.
I'm
Okay,
flattered.
thanks a lot. Bye.
Yeah.
Okay,
All right.
bye.
Bye.
Thanks.